The Diamond Views here are still hot. Join the Will County Black Diamond chapter of Top Ladies of Distinction for Season 2 of The Diamond View. This talk show series features dim black diamonds and professionals discussing topics like holiday planning, taking care of your mental health, budgeting, and more during the holidays. Human trafficking. We can all do our part to prevent trafficking. Love languages. Knowing yourself is the key to unlocking love. And healthy living. Spotlighting our health partners in Minority Health Month. Join us on Facebook Live or YouTube Live for The Diamond View at 6:30 p.m. The Diamond View starts now. On tonight's episode, we're celebrating Minority Health Month with a virtual health fair. Featuring Heart Health with Dr. Fulton Porter. Eye Health with Dr. Janet Wheeler. March of Dimes with TTA. Sickle Cell Disease Awareness with TTA and Nurse Stephanie Oldenwald. And Girl Trek. And now, with Diamond Topics are our hosts, Lady Dion A. Tate, Teen J. Leah, and Lady Moretta Smith. Good evening, good evening, good evening. Welcome to the Diamond View. My name is Lady Moretta Smith. And I am here with my co-hosts for tonight, Lady Dion A. Tate and Teen J. Leah. On behalf of the Will County Black Diamond chapter of Top Ladies of Distinction Incorporated, where our president is Lady Verlena Lane, we welcome you to the last episode of Season 2 of The Diamond View. The Top Ladies of Distinction is a humanitarian organization, and our motto is serving youth and adults. For those of you who are new to our show, thank you for joining us. The Diamond View is the brainchild of the Status of Women Thrust, co-chaired by myself and Lady Tashar Brock. The Status of Women Thrust program focus is health, wealth, safety, and life.
Good evening, everyone. We are excited to welcome Top Teens of America back to the show this evening. Our teens did a phenomenal job with their show last month, and Teen J. Leah, who rocked it, is back tonight to help us celebrate Minority Health Month, a time to raise awareness about health disparities that continue to affect people from racial and ethnic minority groups, and encourage action through health education, early detection, and control of disease complications. We encourage you to grab a pen and paper to take notes on tonight's topics and presentations. Toward the end of the show, we will have a Q&A session with our medical professionals, so write down your questions or drop them in the chat.
And those are your general health questions, not your personal ones.
Good evening, everyone. Before we get into the show, we'd like to invite you to like the Will County Black Diamond chapter pages on Facebook and YouTube so you can stay connected and continue to meet us on Facebook Live or YouTube for the Diamond View. After each show, we want to hear from you. Please make sure you take our survey at the end of the episode and leave your email address. The link will be pinned to the post and in the chat.
So right now we have a commercial for you, and then we're going to get into our diamond topics.
This commercial is brought to you by the Community Partnership Thrust in partnership with Blue Cross Blue Shield of Illinois. We invite you to support Hope in a Suitcase. Did you know many children in foster care transport their belongings in trash bags? We're helping to change that. Join us on Saturday, May 14th from 10 a.m. to 1 p.m. to drop off new or gently used luggage for children in foster care. Donations will benefit Lutheran Child and Family Services of Illinois and Aunt Martha's. The drop-off location is 11840 South Marshfield in Chicago, Illinois. Monetary donations are welcome via PayPal.
So let's get into these hot topics. This weekend, we had an 80-degree day in Chicago in April. Now, it was just one day. It was raining yesterday, but Saturday, that weather was like summer preview. We're not going to talk about all the other things that were summer preview. We just want to talk about the good things, the weather, and the sunshine. I'm excited for vacation this summer. I am still taking my COVID precautions, but I will be wearing my mask when I go to Mexico. So I'm excited to get a little outside sun and just kind of be out and get some fresh air this summer. Teen J Leah, do you have vacation planned this summer?
I have a lot of vacation plans actually because, with the quarantine and everything, we couldn't really vacation or do a lot of things. So actually I'm going to, I think, 2 family reunions, and then I'm going on maybe like just like our own, me and my mom kind of family vacation to Atlanta, Georgia. And then I also am in like this honor program in my school, and we're actually going to be going to like a campsite. So that will actually be really interesting. And yeah, I just really want to be able to relax this summer, have a lot of fun things to do, and just go outside of just Chicago because we've been here for so long. So sometimes just getting that break from everything will be really good, and especially since there won't be any school. So that will be even better.
That sounds great, Teen J Leah, especially the camp. Now, I'm not a camper, really don't like it, but it sounds like that'll be really fun for you and whatever teens that'll be there. This year is the year of 50 for me. So it's a lot of things we got going on. Me and 2 of my good girlfriends, best friends since we were 14, we're actually doing a trip to Miami this summer so we could collectively celebrate 50. So I'm excited about that. I'm looking forward to that. It looks like I saw somebody say in the chat about getting that vitamin D. Yes, just laying out on the beach in the sun, soaking in all the rays of that vitamin D. So I'm excited about that.
So surprisingly, I actually like camping. That's one thing that a lot of people don't know or expect that I would like. But I do like camping. So Teen J Leah, I hope that you have a wonderful experience at the campsite. Get out and get into nature. And we're actually going to talk about nature a little bit later in the show. So stay tuned for that with our Girl Trek session. Let's see in the comments. Yes, people are talking about vitamin D is definitely important to our health. Vacations in Miami, vacations in Jamaica. Who else is going on vacation? I'm also going to Portland, and we'll probably take the coastal drive down California. So I'm excited to do that. I haven't been to California since I was itty bitty, so I'm excited to go as an adult.
Oh, that should be a lot of fun. We actually do have a trip planned just right outside of the summer to the Dominican Republic. So I'm excited about that. Still going to take the COVID precautions, even though they're like, you don't have to wear a mask on a plane. Yes, this girl will be wearing a mask on a plane. So
this girl too. Well, that girl too, right, Jaylee?
Yes.
Someone's doing a 55 trip with about 40 people. So group travel is always great. You can split up your group, go with small groups, do excursions. I love group travel. It's really a time to get to know your friends in a more personal setting, even though you're traveling with everyone. So you have those like couple big events that you do. And then just that time together is so important to build those friendships.
Yep, that is true. I see somebody saying too that camping is refreshing. So maybe I'll have to try it again. Try it again.
Were you a Girl Scout? You didn't go camping in Girl Scout?
No, I wasn't a Girl Scout. So okay. No, I didn't. Like I'm not a nature person, but I'll try it. I will always try something once. Always.
That was my first introduction to camping, and I was like, oh, I kind of like outside. Okay. All right. Well, you know what, ladies and gentlemen, tonight's episode is about celebrating Minority Health Month and raising awareness about the health disparities that exist and affect minorities. We hope tonight's show will encourage you to take action, to care and advocate for yourselves. Self-care is important. Laying on the beach and getting some vitamin D, that's important, but also your actual internal health is important as well. So we want to encourage you to care for yourself, your loved ones, and your communities at large through health education, through early detection, through control of disease complications. So let's start with heart health.
Yes, let's start. So cardiovascular disease is the leading cause of death in the United States, and very recently has been a major contributor to the mortality of the COVID-19 infection. So the National Library of Medicine reports that cardiovascular disease accounts for 1.4 million deaths overall each year in the United States. That's a lot of people. That's a lot of people. And it's with African Americans having 2 to 3 times the likelihood of dying from cardiovascular disease compared to whites at any given age.
That's interesting. Those are exactly the types of health disparities that Minority Health Month is created to address. And tonight we're going to be talking about health disparities with an internist. We're going to jump into that in a moment, but I definitely want to go back. Teen J. Leah, in high school nowadays, are they teaching health classes?
They're actually teaching health classes. Actually, today is the first day where we're starting like our freshman version of sex education and learning like a lot of different things about our bodies and stuff. I wouldn't say they talk much about like specific like diseases or anything, but they definitely do like tackle that topic of like our bodies, our autonomy, what we have a right to do, what we can do in certain situations, and just getting us ready just to know all that information, because we all know it's very important to have, especially as teenagers. So, yeah.
Absolutely. I remember when I was in school, we had nutrition classes, we had a lot of different resources that were made available to us about making healthy choices. At that time, the food pyramid was big. I know since then the food pyramid has been revamped, but we had a lot of choices and resources to help us make better health decisions, despite the fact that we were eating microwave dishes and plastic for lunch. But that's okay, neither here nor there.
Yes, I don't think that helped our hearts too well.
No,
So did you find, like Teen J. Leah, did you find like even though it just started today, did you find the information that you were given helpful? And then to Lady Moretta's point about when we were growing up, we were taught about nutrition and things like that. Do you foresee that happening in your classes, and how helpful do you think that would be for you?
Well, we've been like kind of doing like these health classes pretty much like all of like 7th, 8th grade. And then now we're doing it, kind of age appropriate ways where we're doing it every grade level. And we're definitely learning like new bits of information every day. I don't think we've ever really talked about like nutrition or like the food that we eat, but I do know that there was many different types of, most of it was kind of just like teaching you how to like talk to somebody and communicate about how you, like your health and stuff like that, and how to deal with certain situations regarding your health rather than like the specifics about it, I guess.
Okay. Do you eat healthy? You don't have to answer that.
That's the question of the day. So we'll talk about some tips to maybe help us all get on a healthier track, because it's never too early to start that journey towards healthy living and towards wellness. So we definitely want to set an example for that. Tonight, we are excited to have Dr. Fulton Porter here to discuss heart health with us. So we're going to welcome Dr. Porter to the show.
Good evening.
Good evening, Dr. Porter.
I thought I had lost you for a minute.
No, you are here. We're all here. And we are going to talk about these healthy hearts. Everyone, we'd like to welcome Dr. Fulton Porter to the show. He is an internist and hospital medicine physician affiliated with Community Hospital in Munster, Indiana. He received his medical degree from Northwestern University Medical School. Dr. Porter is one of several doctors in the community healthcare system who specialize in hospital medicine. He is also the rector at St. Thomas Episcopal Church. He is a Morehouse man. He is a member of Omega Psi Phi Fraternity Incorporated. He has a beautiful wife and children. We would like to welcome you to the Diamond View, Dr. Porter.
Thank you. Thank you.
Welcome.
So let's actually jump right in. Based on the information we've learned so far tonight, it seems that we need to know what heart disease is, but then why are heart diseases such as coronary heart disease and heart failure, why are they more common in African Americans? Because that's kind of what tonight's show is all about with Minority Health Month.
Yeah, those are very good, pertinent questions in every month, I think. Heart disease encompasses a number of different sorts of ailments that affect the heart, but most importantly are two, and that's coronary artery disease, which is disease in the blood vessels supplying blood to the heart muscle, and heart failure, which can result from coronary artery disease or other things. Those are the two most prevalent and most important, I think, under the umbrella of heart disease. And when we think about those affected, most people probably almost half of everybody in the United States has at least one of three major risk factors for heart disease. Then the risk factors for heart disease include hypertension, high cholesterol, specifically a high LDL, which is the bad cholesterol. Also obesity, also diabetes, other things that affect your risk for heart disease also include smoking. And believe it or not, sleep disturbances can increase your risk for heart disease because they increase your risk for hypertension. So those are and also other behavioral activities, including limited physical activity, also have become a risk factor for heart disease. So those are the things that we look at when we see whether people are at risk. Oh, I forgot one. Heredity as well. That's a big one. But those are things that we look at when we determine whether people are at risk for heart disease. And we do know that while heart disease has decreased in the population, proportionally, we are still higher as a Black community in the risk for heart disease and the prevalence of heart disease, rather, in our community as opposed to white people. And the question then is, why is that the case? When we look at the risk factors, we have factors that we can control and some that we cannot control. The risk factors that we can control are those that have to do with our diet, that have to do with our weight, have to do with our cholesterol. Those are things that our sleep patterns, cigarette smoking, those are things that we can control. And even looking at recent studies, not so recent, but over the last few years, when we think about how the environmental factors play a role, we see that even we think about heart disease being more prevalent in lower socioeconomic income people, which is the case. However, in middle class and upper class African Americans, the rate of heart disease is still higher in those groups than in white Americans. So there are some other factors here that we have to think about that contribute to the higher prevalence of heart disease in the Black community.
That's some great information that you just gave us, Dr. Porter, because tonight's episode is all about education. So you have outlined causes, risks, things that we can mitigate, things we can do to mitigate that problem, because we do want to focus on action, like the things that we can do. So you mentioned like our diet, you mentioned eating healthy, exercise, things of that nature. So if we want to reduce like our our risk of heart disease? Like how often should we be exercising, and what kind of food should we be eating?
So it's recommended that you get about 150 hours a week of moderate aerobic exercise, which can be you can divide it up whichever way you want, during the week. That's been shown to decrease the risk of heart disease, but also getting screened for other things that need to be treated, including hypertension, is really important. The United States Preventive Medicine Task Force recommends screening for high blood pressure in those 18 years and older. And also it recommends screening for abnormal blood glucose in those 40 to 70. However, realistically, in patients that come into the office, we begin those screenings much for elevated glucose much earlier than that. And so knowing those things, whether you've got hypertension or not, whether you've got a risk for diabetes or diabetes, is really important, because then you can control those risk factors, because hypertension has been called the silent killer, because a lot of times there are no symptoms. And when there are no symptoms, by the time we get symptoms, we've got the damage and it's too late. So screening for those things that can be controlled is important, and then controlling them is important. Taking our medications, if we have them, for our hypertension and for our diabetes, that makes sense as well, to have medications that we take for these things, and we're still not controlled. There are some people who are taking medications for hypertension and diabetes who go to the doctor's office, and their blood pressures and blood sugars are still not controlled. The question is, what is your provider doing about it? What are you doing about it? What's the game plan? Because we're kind of spinning our wheels and not doing ourselves any good, just taking medications for no reason. So making sure that we're taking our prescribed medications, communicating with our providers to make sure that there's a proactive approach to making sure that what we are taking and the other things that we're doing in order to control our health conditions are indeed working. Certainly, increasing our activity is important. Getting good exercise. We talked about the 150 minutes of moderate aerobic exercise a week, which would be important. That could be walking a couple times a day for 10 minutes or so, getting our heart rates up. Eating a healthy diet, and the American Heart Association recommends a diet high in fruits and vegetables, and cutting back on the red meats. We definitely want to make sure that we do that, because that also helps control another risk factor, high cholesterol. And again, we do take medications for high cholesterol, but if we're not controlling the cholesterol and we're on the medications, it makes no sense. So I think we have to make sure that those risk factors are being controlled based on the interventions that we're doing. One of the other things that can be kind of an early harbinger of heart disease is leg pain. And what I mean by that is if you go out and you walk and you begin to have severe pain in your legs, sometimes it's not cramping, sometimes it's circulatory issues. And if you have peripheral vascular disease, that can also point to the fact that you may also have coronary artery disease, which is a blockage of the blood vessels that supply blood to the muscle of the heart, and may be at high risk for a heart attack. So when we notice those things, don't ignore them, get them checked out. I think the exercise and the diet leads to helping us to maintain a healthy weight. And that's very, very important, because weight obesity has been linked as a direct risk factor for heart disease. If your belly circumference is larger than your waist circumference, you're at particularly higher risk for lots of things, but including that list, heart disease and heart attack. So those are some of the few of the things that we can do, I think, to help prevent heart disease. We can't control the genetics. Sometimes we have no control over the environmental. A lot of our people may live in areas where they are not able to go outside and walk, and so those can be barriers to a healthy lifestyle. They live in areas where there are food deserts, and there could be barriers in that way to them getting healthy food, fruits and vegetables, etc. And so I think as a nation, as a community, we have to begin to look at those barriers and try to break them down for the communities which are affected by them. The other thing I think that's important is looking in the pediatric population, trying to make sure that we control risk factors early, because those kids grow up to be adults. And the longer they have those risk factors, the more at risk they're going to be for heart issues. There's only a minority of a small percentage of kids who have hypertension, for instance. But it's important that your pediatrician follow up on that, check blood pressure for children to make sure, and also children with weight issues, etc. Advising on physical activity and diet. All those things starting early on can then help to prevent heart disease in the future.
I like that you talk about starting early. Are there any specific tips that generally healthy teens can take to reduce their long-term risk of heart disease and just overall health issues? Like, what steps can they start taking now? Is it making sure they drink their water? Is it just making sure that they add maybe a vegetable to their plate? Or what can they do?
I think probably the biggest thing, and all those things are very good. I think they're important. But the biggest thing is increasing the physical activity, because I think now we live in an age where our teens and youth can be very sedentary because of the technology that we use every day for pleasure or work or whatever. We're sitting in front of the computer, the television, looking at our iPhones, and we're not doing the physical activity that, for instance, we used to do when I was a kid. I mean, it was like there was not video games. You just went outside and you ran around till the street light came on. So our kids are not doing those things these days. So sometimes that means putting kids into structured activities like sports and other things that may be helpful to keep them very active, which will also keep their weight down and that sort of thing. But certainly the second most important thing, or probably equally as important, is the diet. I mean, I think that we live in a right now society. We've got all the processed foods, microwave foods, fast foods that we may be eating to excess, and making sure that we are putting together healthy diets for our kids so that they can have some healthy choices, even in the schools that still serve lunches. Is going to be very important. That's why I think Michelle Obama's initiative early on about childhood obesity and diet has been so important in raising the awareness in our nation of the need to make sure that we give our children healthy choices.
Yeah, you've provided some great information when it comes to our diet, and even when you made the point about taking our medication and knowing that if it is actually working and controlling whatever the issue may be, high blood pressure, high cholesterol. So we do have one last question for you. We've been living through COVID-19 for the past 2 years, and that's, everybody's like, will it ever be over? And with mask mandates now, they're being lifted. We talked about that earlier. We have a vaccine, we have boosters, but COVID numbers are still on the rise. So we want to encourage our viewers, one, to still remain vigilant, like during this whole process. Be safe. Still wear your mask because it's still here, alive, well, and kicking. But we want to know, how does COVID increase the risk of heart disease?
It absolutely does. There is a study recently that came out of Johns Hopkins that talked about long COVID syndrome and specifically addressed heart disease. And so even if you had COVID, had a relatively mild case of COVID, you nursed it at home and you were fine, you didn't require hospitalization. They've looked at people over a year's time and found that they did have increased risk of heart disease. More study is needed to kind of fully understand, what's happening. But COVID can cause inflammatory processes in the body that can affect the heart muscle, heart vasculature, etc. And it can cause a higher incidence of blood clots, which we see all the time in our COVID patients who come in with blood clots that go to the that are in the legs or go from the legs to the lungs, which can also be more indicative as well of blood clots that can form in the heart vasculature that can cause heart attacks and other things. So yes, COVID is a risk. It has been shown to increase the risk of heart disease, and so there are studies happening right now to take a closer look at that. Now, the question then is, people with breakthrough COVID, if you have been vaccinated and get COVID, what is your likelihood then as a vaccinated person? The jury's still out on that right now. So we'll probably know more information over the next year or so in terms of what the risk is for those. So absolutely, staying safe prevents your risk of heart disease related to COVID and long COVID symptoms, which include brain fog and diabetes can be a result of long COVID, as well as heart disease as well. So trying to stay as healthy as we can in this pandemic is going to be really important, not just for the here and now, but for our long-term benefit.
Thank you, Dr. Porter. We're going to have you hang tight backstage and come back for some Q&A at the end of our episode. We appreciate that information. That was very informative. And we are now going to talk about eye health. So when it comes to vision health specifically, I found this very interesting. Minority populations are not adequately represented in modern research. And so as I'm reading, I'm like, wait, it's 2022. Medicine is advancing. Society is advancing. How is this even possible? But the thing that happens is, because minorities are not represented in the research, it puts people of various ethnic groups at a serious disadvantage for being able to take care of their eyesight over the long term. And it exposes them to higher rates of certain forms of vision loss. So glaucoma and cataract disease are the top two diseases that affect minorities, African Americans in particular.
Yeah, that's some very interesting information. So tonight, we are proud to welcome Dr. Jeanette Wheeler to discuss the differences between those two diseases and explain the screening process. Hopefully, this information will encourage you and or your loved ones to get your screening or feel more comfortable with the process. Dr. Wheeler is an optometrist at American Vision Center in Chicago. She is the clinic director of their specialty clinic focusing on the management of dry eye disease. Her other areas of clinical specialty include nutrition, aesthetics, and glaucoma management. Dr. Wheeler is passionate about providing quality care to her patients by educating them on how vision integrates into the larger picture of health and whole body wellness. A native Chicagoan, Dr. Wheeler is proud to serve the same community she grew up in. She enjoys mentoring youth with interest in the healthcare field. She obtained her undergraduate degree in biology from North Carolina A&T State University in 2002, and went on to earn her doctor of optometry from the Illinois College of Optometry in 2008. Dr. Wheeler is a life member of Delta Sigma Theta Sorority Incorporated. Dr. Wheeler, welcome to the show.
I just want to say that's my friend. So I call her Janet, but we'll call her Dr. Wheeler for tonight, I suppose. Give that woman her titles. So tonight, Dr. Wheeler, I know that you have prepared some information for us. So we are all ears and eyes. Absolutely. And so to start, can you tell us what actually happens during the eye exam? But I'm going to pause you for one moment because it seems as though the people cannot hear you. Are you able to turn up your microphone, Dr. Wheeler?
So I can hear you. I don't know. Let's see if we get some comments in the. So yeah, we're hearing that they can hear you. Yes, they can hear you. So we're
all
good.
right. Thank you, Dr. Wheeler. And thank you to our audience in the comments. We appreciate you, and that's what you're here for. So thank you. Sure. So to start off, can you tell us what actually happens during an eye exam?
Okay, so Dr. Wheeler, how would someone know if they need glasses, and does wearing glasses mean something's wrong?
So that's interesting. You mentioned in the beginning that you do an ocular health assessment. What exactly is that? Is it really? Because I don't think it is.
I think it's the worst.
No one wants puff blown in their eye.
Where it's a live show, things
Right.
happen.
Dr. Wheeler is busy. Let's actually go back because I know a lot of people have questions about what astigmatism is, especially after that commercial where they're like, "I just have astigmatism. It just means I just don't see as well out of one eye." And I was like, "I'm pretty sure there's more to it" when I saw that commercial. But can you explain what astigmatism is? And so I know you mentioned when we were chatting before that there are other things that people do, like as they're getting older and they think that it's a serious issue. Sometimes it is, sometimes it isn't. But when you're doing this thing here in the far away thing, what are we doing with that? We're like,
The trombone.
they're
Yeah.
making very fashionable bifocals nowadays. I'm just saying.
Everything. Yeah, I'm guilty of the trombone syndrome. I'm always like, what's that?
So I know that earlier we talked about how glaucoma and cataracts disproportionately affect minorities. Can you explain the difference between those two?
That's great information too. And Dr. Wheeler, so sometimes I get like a little black dot that kind of floats through my eyes, like I'll see it floating. Is that something to be concerned about? That's great. Great information. Yeah, I'll be making an appointment with you soon. Yeah. So with that, how can the audience reach out to you to schedule an exam?
Dr. Wheeler, aka Jan, thank you for that information. We are so excited to have you here on the Diamond View. Hang tight. We have some questions in the chat, and we are going to throw those at you during the Q&A, okay? Thank you. Next up, we are going to bring Teen J. Leah to the screen. You met her last month for our TTA episode. Teen J. Leah is here to report on March of Dimes, and she is also going to talk about sickle cell. So, Teen J. Leah, take it away.
March of Dimes, also known as March for Babies, is of the National Partnerships for Top Ladies of Distinction Incorporated. March of Dimes leads the fight for the health of all moms and babies. We support research, lead programs, and provide education and advocacy so that every family can have the best possible start. What began with President Franklin D. Roosevelt's personal struggle with polio led to the creation of the National Foundation for Infantile Paralysis, better known as March of Dimes. March of Dimes pioneered the vaccine research leading to the eradication of polio in the U.S. and then shifted focus to address some of the biggest health threats to moms and babies. Today, they educate medical professionals and the public about best practices, they support life-saving research, they provide comfort and support for families in NICUs, and they advocate for those who need it most, moms and babies. The Will County Black Diamond chapter of Top Ladies of Distinction and Top Teens of America is currently participating in a fundraiser for March of Dimes. Yesterday, we had our virtual walk, but we are still accepting donations on our fundraising page. We encourage you to support us on reaching our fundraising goal of $2,500 for this important cause by visiting our March of Dimes page to donate. You can visit the link in the chat.
You're watching The Diamond View. April is Financial Literacy Month. The Will County Black Diamond chapter of Top Ladies of Distinction Incorporated is proud to partner with the Chicago Central section of the National Council of Negro Women to bring you a financial literacy series. Visit our social media sites to explore the series and stay tuned for next week's sessions. Investing tips with Penny Gomez and real estate investing tips with Curtis R. Monday. And TTA with Teen Financial Literacy Tips.
The Sickle Cell Disease Association of America Incorporated is a Top Ladies of Distinction Incorporated national project and affiliate. We know that sickle cell disproportionately affects minorities, and we are thrilled to be part of the education that may help minorities better recognize sickle cell traits and manage their sickle cell. Our chapter has built a relationship with Lurie's Children's Hospital through Sarah Knoll, works on the sickle cell team there. Tonight, we are excited to welcome Nurse Stephanie Odenwald of Lurie's Children's Hospital to share information about sickle cell disease. Stephanie Odenwald is a hematology nurse practitioner at Lurie's Children's Hospital, Chicago. She received her Master's of Science in Nursing at the University of Illinois at Chicago. She specializes primarily in working with sickle cell and thalassemia patient populations requiring chronic transfusions. Welcome to the show, Nurse Odenwald.
Hi, Team Julia. It's so nice to be here. Thank you so much for having me here.
Nice to meet you, and we're so excited for you to give your great insight of you being a professional and helping the public know more about sickle cell. I know that lots of people have heard of the sickle cell disease, but don't know exactly what it is. Can you start by explaining what sickle cell disease is?
Yeah, that's a very good question. So just to start out with a general overview, sickle cell anemia is a genetic disorder where a person's hemoglobin, which is the protein on the red blood cell that carries oxygen, is deformed. So this deformed hemoglobin results in red blood cell-shaped abnormalities. And as you can see on this figure, a person without sickle cell typically has donut-shaped red blood cells, which flow really nicely through the vessel. However, in sickle cell disease, the image in the lower end of our slide, you can see the red blood cells turn into sickle or banana-like shape, and they become hard and sticky. So due to this abnormality, the lifespan of a red blood cell for a patient with sickle cell is only 10 to 20 days, compared to the normal red blood cell, which lives about 110 to 120 days. So this rapid breakdown in red blood cell leads to reduction of overall blood, which is called anemia. So when a person is living with anemia, their heart works extra hard to provide oxygen to every part of their body, because overall they have fewer red blood cells to carry the oxygen. So when red blood cells break down, when they're sickling, they release chemicals or proteins that create a sticky environment, and it increases inflammation to those areas in the vessels. So this rapid breakdown of red blood cells and inflammation leads to what we know as pain episodes or vaso-occlusive episodes.
That's very interesting to hear. I remember actually learning more about this in like my 8th grade like biology class, learning about like sickle cell and the type of blood cells and how they like change. So it's actually really interesting to learn from somebody who actually studies it. And with this being Minority Health Month, we are highlighting and educating on diseases that disproportionately affect minorities. So which populations does sickle cell disease tend to impact?
Definitely, that is an excellent question. So now that we know a little bit about what sickle cell disease is, it's really important to know who is impacted by this disease. So this map depicts how many people were born in 2015 were diagnosed with sickle cell disease. So sickle cell disease it's very interesting. It originates from a genetic mutation that protects individuals against malaria. So therefore, sickle cell disease was developed or originated in countries where malaria was very common. In fact, Africa accounts for about 82% of patients of malaria cases worldwide, which is why sickle cell disproportionately impacts the African and African American population of higher prevalence. So kind of going from this world map a little closer to home, in the United States, sickle cell disease affects approximately 100,000 Americans today. So sickle cell disease occurs among 1 in every 365 African American births. And in fact, about 1 in every 13 African American babies are born with sickle cell trait, which means that person has the ability to pass along sickle cell disease.
That's actually very interesting. I don't think I've ever heard of anything, relating exactly to a specific ethnic group or a specific race. So it's actually really interesting to know that our group of people is really affected by it, and hopefully we'll be able to see more about it and learn more how we can prevent it. So the overview of sickle cell has been really informative, and earlier we mentioned how a lack of representation can affect treatment and diagnosis of diseases. Can you tell us more about the intersection of race and medicine?
That is such an important factor to address. So to discuss healthcare disparities for patient populations, it's really important to look at where the U.S. government funding is going to support research and development for disease-modifying or curative therapies. So I want to kind of compare sickle cell anemia research and treatment development to another chronic disease called cystic fibrosis. So as I mentioned earlier, sickle cell anemia impacts approximately 100,000 Americans. In comparison, cystic fibrosis impacts approximately 35,000 Americans, which is about 1/3 of our sickle cell patient population. So significantly lower. And just to kind of bring it back, cystic fibrosis impacts primarily patients of Eastern European or white individuals. So I have a graph up here which depicts research grants, program projects, and centers dedicated to each disease from the time span of 1974 to 2004. So this historical funding for these diseases really impacts current day-to-day treatments and overall patient outcomes. So the black bar you'll see represents cystic fibrosis funding, and the gray bar represents sickle cell disease funding. So unfortunately, as you can see, the National Institute of Health allocates nearly 4 times more funding per person affected with cystic fibrosis as it does for those living with sickle cell disease. So we do still have a very long way to close these racial disparities in medicine. But I will say one very important factor to closing this gap is youth advocacy through volunteering with your local sickle cell organizations. One of which is very close to home, is the Sickle Cell Disease Association of Illinois, also known as SCDI.
Yeah, that's really fascinating to learn about. It being 2022, you definitely want to see more advancements and more development. So it still is kind of sad that we're still kind of going through these disparities, but hopefully as we go on, our world becomes more interactive and more open, and as people say, woke about our environment, it will definitely hopefully get better. So I'm also interested to know, what advancements has there been in sickle cell disease, and what does the future of sickle cell disease look like?
Definitely. So I do want to emphasize we are continuing to move forward as a community with sickle cell disease. And although we have a very long way to create a more equitable healthcare system for our sickle cell patients, I do want to highlight our work towards improving research and comprehensive care to our sickle cell patients in the U.S. So especially within the last 30 years, our research and treatments have come a very long way. In fact, we have developed 3 new drugs within the last 30 years to improve the overall health and outcome of patients with sickle cell disease. So these 3 drugs, they're called hydroxyurea, Oxbryta, and Adakveo. And these drugs have significantly improved the lives of our patients with sickle cell through decreasing pain episodes, decreasing overall hospitalizations, and just improving our patients with sickle cell, their overall quality of life. We're also really working towards more accessible curative therapies for our patients with sickle cell disease. Since this is a lifelong prognosis, we now have stem cell transplant options for patients with matched sibling donors to ideally cure their patient with sickle cell. We also currently have many studies in the US being performed on gene therapy and gene editing. So what this does is it corrects the disease at a molecular level, in turn completely curing the disease. So we're currently in the preliminary stages of these gene therapies and gene editing therapies, but I'm really excited for the progress that we've made so far and really look forward to a future of more equitable healthcare.
Yeah, that's really cool. I actually know somebody who deals with sickle cell disease, and it's really good and like hopeful to know that there are going to be better opportunities for them to get treatments, feel better, you know, because from what you like are saying and like your experience of like talking about it and studying it, it does seem like it's very, you know, painful. It seems very like it's not the best thing you would want to have. And it's really great to see people having these new looks and new research and new studies to actually improve and develop into a world where people can get treated and won't be in pain and won't have to feel the way they're feeling. And it's really cool that you are studying this and teaching about everybody about this. So thank you so much for joining us. And next up is Girls Trek.
All right, thank you.
And we are back with Girl Trek. So, as we mentioned in the first segment, which was our heart segment, walking is definitely a great way to experience some health benefits. Girl Trek is a global movement of Black women who are leveraging historic legacy of walking and the power of self-care as a pathway to heal and transform their lives. Girl Trek believes that walking 30 minutes a day is a radical act of self-love and is the root of a cultural revolution. If you watch Good Morning America, you may have seen the founders of Girl Trek, Morgan Dixon and Vanessa Garrison, on the show being featured last week.
They shared their initial inspiration of launching Girl Trek was the health crisis that we saw within Black women. Physical health problems that turn into what they said affected their mental health. And that's a big thing now with Black women, our physical and mental health. So here are some stats. Here are some stats for Black women's health according to the Girl Trek website. So from 5 to 10 years, 5 to 10 years less life expectancy for Black women behind any other racial group. That's a big number. 81% of Black women are overweight. 52% of Black women are obese, and 20% are less likely to engage in any physical activity.
I think those numbers are alarming. I also think that the metrics are not necessarily where they should be. To the representation in health studies, which we talked about earlier. So I think that all of these things that we're talking about, when we talk about social economics, when we talk about research and medicine, like all of these things have an effect on the disparities in race and health. And so I think that tonight, having the show and bringing this attention to this will help us better be advocates for our own health, for our people's health, for people who look like us, for people who don't look like us, that we can all band together to make the healthcare system work for us as well, and work for our bodies and work for our loved ones in our communities. Girl Trek has definitely shown the healing powers of walking. Their members are definitely reporting increased they're reporting using medication less. So 28% are reporting being prescribed less medication once they have started Girl Trek. 78% have been inspired to try new fitness activities. 61% report losing weight, an average of at least 15 pounds. And then 90% of those who were diagnosed with depression said that their walking improved their symptoms. And of the people who have started Girl Trek and been walking for more than a year, 56% of them have sustained 5 days or more per week of walking. So this is definitely a tool that is increasing the health of Black women. That website is girltrek.org, and they offer all the tools that you actually need to get started with the project. So it's as simple as walking. You can do it on a treadmill, you can do it outside, anywhere.
Which is good. It's good for the heart, right? So the website also offers resources that you can access for guided walks, podcasts with Black history facts, women's history facts, curated playlists. It gives you a plethora of ideas to get out there, get moving, get walking, just like Lady Moretta said, whether it's outside with a group of women, by yourself, or even on the treadmill. So there are resources out there.
in the living room, even just in front of the Bluetooth speaker while you're playing the podcast. It has everything you need to get started. I've done some of the series, and I've actually found myself extending the walks because I'm like, oh, that's juicy. And it's almost like they're telling you about, Harriet Tubman as if she's your girlfriend that you just are finding all this information about. And it's really interesting the way that they curate the resources there. The cool thing is you can do it on your own, or you can connect with the crew. Or make your own crew. Girl Trek follows the philosophy of where two or more are gathered, meaning if you and one other person or two other people get together for walking that week, even if it's virtually just to connect, you are committing to hold each other accountable for that radical self-care of taking that time just to walk.
Yeah, I think when you say that, I think about like me and my friends. Like the biggest thing with all of that and with Girl Trek, which I think I like the most, is the accountability piece. So if you schedule this outing with your girlfriends, you're walking with them, you're motivating each other, you're getting each other to kind of, have a plan for the day, get that exercise in, get that heart pumping, and being there for one another. So it's an agent to change the health landscape for Black women in particular. So it's something that to motivate us to get that movement in that we need to make sure that we're healthy physically and mentally.
Absolutely. Our community beautification thrust of Top Ladies of Distinction at the Will County Black Diamond chapter, we invite you all to participate in our virtual Girl Trek nature walk. So we talked about nature a little bit earlier with the camping, but we're actually going to have a nature walk. And that is anytime you want to walk, May 28th or 29th. Take a nature walk on a trail or maybe a small hike, and tag the Will County Black Diamond chapter in your nature walk photos. So we invite you to participate. Check out the website there for nature walk resources. Again, that's girltrek.org. At this time, we are going to welcome all of our guests back for some Q&A. I know that we've got some questions throughout the evening as we were going along. So we are going to welcome them back to answer some of the pressing questions from the chat. To start off with, Dr. Wheeler, you'll get the first question. Someone wanted to know, when should young people begin to get their eyes checked? Thank you for that. Dr. Porter, someone wanted to know, what are some small changes that people can make to decrease their risk of heart disease? We talked about it a little bit, but what about just the small changes for the person getting started?
The two that I hold most important are diet and exercise. Those are two of the most important things I think that can affect a plethora of the other diseases that can be risk factors for heart disease. And I like small changes, and because when we try to do something and jump headlong into it, a lot of times we get discouraged and we stop. So if we're disciplined enough to be persistent and hang with small changes, they become big things. So for instance, one of the things that I tell people to do before they totally drastically change their diet is put on your plate what you would normally eat and then take half of it off. And that gives you a visual of you might be eating pork chops and all that other kind of stuff, but even with that, start with decreasing the amount that you're eating. That will lead you to a caloric deficit, which will help you to lose weight. You'll be surprised at how fast that will work in helping you to lose weight. Concentrated sweets is another thing that that we want to cut back on. If you're drinking canned soda, decrease the amount. If you're drinking, a couple Cokes a day, decrease to 1 Coke a day. But it'd be good to stop it altogether and replace it with other alternatives. Some people say, I don't like just regular water. Well, there are all sorts of alternatives now. You can put additives in your water that makes it maybe taste a little bit more pleasing to you. But water is always the best. The other thing is find an activity that you feel like you can sustain. It may be walking, and you may walk just a couple blocks, and you continue to do that on a regular basis. You'll find yourself increasing little by little over time and getting better. So those gradual things are important, and sticking with them is probably the most important. And I think graduality helps us to do that.
Thank you so much for the insight on how we can better help ourselves and our heart health as we get older or even when we're younger. So thank you for that. And Nurse Stephanie, what are some of the symptoms of sickle cell disease, and how will someone know if they have it?
That's a great question. So fortunately, starting around in the 1980s, it's part of our newborn screening in Illinois. So every newborn who's born in Illinois does get tested for sickle cell disease or sickle cell trait. So after 1980 or so, everyone should have that information. But just in case you were born before, you can get tested through your hematologist. Signs and symptoms of sickle cell primarily are pain and also anemia. So if you go to your primary care doctor or your pediatrician, you can get a CBC, and generally the red blood cells and the hemoglobin will be lower.
Thank you.
Yeah, you're welcome.
Thank you, Nurse Stephanie, and thank you to our guests tonight. Ladies and gentlemen, tonight's conversations have certainly been educational. We hope that you have taken something away from this health fair that will help better support you, that will help better support the health of your loved ones and your community. So tonight, we definitely want to thank our guests for joining us, and get any parting words that you may have. Dr. Porter, do you have any parting words for us?
Well, I think I wanted to commend you on this forum, which I think is very important. I think you're doing a very important service to our community, giving them the information and helping them to know where the resources are that can help them be healthier. I think that my parting words would be that nothing happens overnight. And so what we must do, I think, in trying to lead a healthy lifestyle is be patient and consistent. Patience and consistency, I think, will get us to where we want to go in a variety of endeavors. But I think in helping us to lead a healthier lifestyle, it's going to be really important that we be patient and consistent.
Thank you, Dr. Porter. Dr. Wheeler, do you have any parting words for us this evening? Thank you, Dr. Wheeler. Nurse Stephanie, any parting words?
Yeah, I do want to thank the top ladies of distinction, Will County Black Diamond chapter, for just inviting me to be a part of this conversation. I think creating awareness about the inequities in our healthcare system is the first step in moving forward. And it's so important to be empowered with knowledge. So as we have that information, we can work with what we have. And kind of backpacking off of Dr. Porter, it's really important to be patient and take it day at a time.
Thank you, Nurse Stephanie, and thank you to all of our guests. Well, tonight we want to say thank you to the Status of Women Thrust and TTA for all of your hard work that goes into producing these shows. In the chat, we have Lady Beverly this evening and all of our Will County Black Diamond members. Thank you. I would also like to thank my brother, Joseph Smith II of Graymore Photography, for our audio visuals. And we want to thank you, our audience, for joining us for this episode of the Diamond View. Do our hosts have any parting words for tonight?
I just want to say, thank you everybody for coming. Thank you to all our guests. It's very important to know about our health, especially as Black people. We all know the discrimination in the healthcare, and it's always great. We should always be grateful and be happy to have the opportunity to get professionals to talk about us, specifically our like numbers and our health. And it's really important to always look after yourself, never neglect yourself, always look at yourself first, and just make sure you remember all this information you have. It will be very helpful for you, and hopefully that what they said today helped you guys maybe notice something about yourself that you know that you should get checked out, or just having that information for the future.
As always, you rock it, Team J. Leah. It was great. So, and honestly, to piggyback off of what she said, I thought that this was a phenomenal show. It gave a lot of information to our community, our Black community, about our heart health, about our eye care, about sickle cell. And these are things that we need to know about. And we talked about Girl Track, walking, getting that physical exercise so that it can help our mental as well. So I think this show was phenomenal. The speakers all gave great information, and I hope that someone got something from this show that will assist them in the future.
Absolutely. And as we close out this recognition of Minority Health Month, we just want to be aware that sometimes just knowing is the first step. So there are so many things that affect us. We hear about, someone's building a new grocery store in this area. When we hear about it in the context of tonight, that someone building a grocery store in a food desert could help save someone's vision, could help save someone's life because they might avoid heart disease. When we hear about it in those contexts, it becomes that much more important that we are not only advocates for ourselves and our health, but that we're advocates socially, and that we're aware of what's going on in our communities, and that we're advocating for equal business and equal access to basically living, to have the liberty to decide, do I want to go to Jewel or do I want to go to Mariano? Not do I want to go to the corner store and that's my only option. So just having that awareness tonight maybe will help someone decide, maybe I want to get involved in my community a little more because I see the big picture. So we hope that you have learned something tonight for yourself, for your family, for your community. We thank you for joining us. Again, thank you for watching the Diamond View. And until next time, keep shining.